A poor prognosis tonight for Steward Healthcare. The for-profit health system runs 9 hospitals in Massachusetts. Now we're learning the condition of Steward's financial health is so critical that at least some of those properties, including Good Samaritan Brockton, are in danger of closing. That's upsetting. This is Dr. Todd Allerin. He is the Vice Chair of Medicine at South Shore Health. Thanks so much for being here. It's upsetting because you never want to see a hospital close. Holy Family in Methuen and in Haverhill, Neshoba Valley Medical Center in Ayer. Closer to you, Morton Hospital in Taunton. I gave birth at Morton Hospital to my son 24 years ago. Good Samaritan as well. So the question is how important, I can't even believe I'm asking you this. They are important. All hospitals are important to the state's health system.
These hospitals are so important. We are all seeing unprecedented volumes. Our system is seeing over 500 patients a day coming through. We're licensed for 393 beds. You can just imagine that. So we're all being pressed to the brink. And I think the most important thing to note is that this is happening with 2020, 2 hospitals closed, Quincy ED. Norwood, 2023, you know about the Brockton fire, that closed.
Norwood flood too, that's what that was.
Right, and then Compass closing. So, this is all, we have to follow the dots, and we're being stressed every day. So I think it's really important that these hospitals can't close.
But is that the reason why this is happening? Because you're overrun with patients? And is there anything you can do if you are a patient?
Well, first of all, I don't want to speculate. We don't know that the Steward hospitals are closing. They're doing everything they can to stay open. And remember something, they are caring for some of the most vulnerable people in our state. 70% of Steward patients are Medicare and Medicaid patients. So this is really important. So I don't want patients to panic. And I think our CEO, Dr. Alan Smith, said it best today though. A sudden closure of a hospital would be extremely dangerous, but we are planning, and I have to give our staff so much credit because they're working overtime every day to make sure the flow stays, as safe and to keep up that important and critical level of patient care.
And that's just such a gift that we have when you hear those words, right? That's the commitment that you make as doctors and nurses and staff and hospital administrators as well. You have a chronic condition. Should you start working on another plan just in case?
I think Plan B is important. Again, I don't want to speculate. So far, Steward has only said that they're going to close a rehab in Stoughton in the spring. Okay, hopefully that doesn't happen. But I think what patients can do is, especially if they have procedures coming up or appointments in one of the Steward hospitals, you can call in advance to the office to make sure that your appointment is still going to stay. Also, check your insurance plan. You can always look just in case at what other providers are going to be in your network. They can offer a lot of help. So, there is help there. I know the state is doing a lot. The governor and her team, the Department of Public Health, working with Steward very closely. I know in our system, we are working every day to consider emergency plans, whether it's opening ED beds, whether it's increasing surge capacity on our units, whether it's opening, transitional OB beds. We're doing as much as we can given the footprint and the space that we have.
Interesting. Dr. Todd Allerin, thank you so much. We appreciate your time as
always.
Thank you, Maria. Stay well. Be well.